السلام عليكم. انا معكم النهارده هنشرح ارتكل ريفيو عن جلوكوما. بس قبل ما ابدا حابه اقول موقف بسيط حصل معايا انا شخصيا، وده كان السبب ان انا اخترت ارتكل ريفيو بتاعي يكون موضوع عن الجلوكوما. وهو اني كنت في امتحان اورال في الجامعه بتاعتي ساوث فالي يونيفرسيتي، و كنت بتكلم عن الاتروبين. واتروبين هنعرف بعدين ان هو كونترا انديكيشن، ممنوع في حالات الجلوكوما. وقلت ان الاتروبين سبستيتيوتنت بتستخدم كاي دروبس ان جلوكوما. معرفش ازاي قلت كده، بس عامه الدكتور قال لي انت كده عايزه تفرقعي عين العيان. و بصراحه الجمله دي هي كانت السبب اني لما اخترت ان انا اعمل اول ارتكل ريفيو على اكتر موضوع حبيت اعرف عنه اكتر غير الحاجات اللي احنا بندرسها في الكليه كان موضوع الجلوكوما. اللي عايزه اوصله من الموقف ده ان دراستنا في الكليه مش مقتصره بس على الكتب الدراسيه، مش مقتصره بس على الحاجات اللي احنا بناخدها. احنا لازم نربط الريسيرش بدراستنا، لازم نحاول نوفق ما بين الاتنين مع بعض ونطلع اكتر على البيبرز وعلى اخر التطورات في الحاجات اللي احنا بندرسها. ودي هي رسالة الاونلاين كونفرس ده، ان احنا نشجع الناس ان هم يبدأوا شغل ريسيرش من دراسة ويحاولوا يربطوا بين الاتنين. وسبيشال ثانكس لدكتور عمرو عبد البعث والانترناشونال ميديكال ريسيرش سكول IMRS ان هي ادتنا الفرصة ان احنا نكون من التيم ده ونبدأ شغل الريسيرش معاهم. واتمنى ان احنا نكمل في الشغل ده. خلينا نبدأ. جلوكوما The Secret of Silent Thief. الitems: glaucoma, what is glaucoma and its pathophysiology, what are the types of glaucoma, who gets glaucoma and its risk factor, what are the symptoms, how it is diagnosed, and management and treatment of glaucoma. Glaucoma is considered as a global health problem as it affects 60 million worldwide, and it is the second leading cause of blindness all over the world. So it is a serious condition. And why it's called a silent thief because it slowly damages the eye as patients have no symptoms. It is unnoticed until the late stage in this disease. So it is can irreversible vision loss and damage of the optic nerve. The definition of glaucoma: it is considered as a neurodegenerative disease because it is lead to degeneration of the optic nerve and loss of retinal ganglion cell. This ganglion cell which conveys the visual information from the retina to the brain. So when it is affected, it is caused vision loss. It is mainly depend on intraocular pressure, the pressure in the eye. It is an important risk factor for development of glaucoma. Intraocular pressure can cause damage of the optic nerve, and if it is continuous without treatment, it can cause permanent vision loss. Pathophysiology of glaucoma. But before we will talk about pathophysiology, we need to know about the physiology of the eye. So in this picture, in this cut section of the eye, here this is cornea, and this is called iris, lens, and this is optic nerve where which is affected. We show here that eye is divided into two sections: this large posterior section and anterior section. This posterior section is filled with fluid, gelatinous fluid. It is called a vitreous humor. It's make a supporting for the eye globe and maintenance its shape. But what most important in glaucoma, it is this anterior section, which is divided into two both a two chamber. Anterior chamber, this anterior chamber, and this narrow posterior chamber. Anterior chamber from the cornea here to the iris, and posterior chamber from the iris to the lens. This is filled with fluid. It is transparent watery fluid called aqueous humor. Aqueous humor is forming by ciliary body, this ciliary body, and then pass here to be drained into a trabecular meshwork. Trabecular meshwork, it is a spongy tissue, act as a drain where the aqueous humor go out to the venous circulation around the eye. In glaucoma, what happened? There is partially or completely block of the drainage pathway of the aqueous humor. So the fluid can't easily drain out. This causes the pressure within fixed space of the anterior chamber quickly rise up, causing intraocular hypertension, which hypertension greater than 21 millimeter mercury. This pressure affects all the structure of the eye, mainly the optic nerve, and cause a damage of the optic nerve, which conveys the visual information to the brain. This lead to vision loss, as we mentioned before. This is physiology and pathology of the eye, of the glaucoma. Types of glaucoma. Mainly, glaucoma is divided into two main types: open angle glaucoma and angle closure glaucoma. Both can be divided into primary and secondary. Secondary glaucoma result from many other pathogenic processes as the malignant tumor or trauma, or other medication as systematic or topical corticosteroid. But what most important is primary types of glaucoma: primary open angle glaucoma and angle closure glaucoma. Pathophysiology of each type. Here, open angle glaucoma. First, why it is called open angle glaucoma? Because the angle between this iris and the lens is opened, so it is called open angle glaucoma. So what is the problem? The problem here, there is a resistance to outflow of the aqueous humor here in trabecular meshwork. So a fluid can secrete it from the ciliary body and pass from the posterior chamber between the narrow space between the iris and the lens, and then pass here to anterior chamber, but there is resistance to its outflow from the eye, so it is lead to accumulation and increase intraocular pressure. But in the other type, closed angle glaucoma, the angle between the iris and the lens is blocked by the iris or other infections here. So the fluid is secreted from ciliary body, but when it can pass between the iris and the lens as the pathway is blocked here. So it is accommodation in this narrow space and can outflow here, lead to increase intraocular pressure in this fixed small space and increase the convexity of the eye lens or eye globe. So this is pathophysiology of both type of glaucoma. In open angle glaucoma, there's a resistance to outflow from trabecular meshwork, and in angle closure glaucoma, the angle is closed by the iris and the fluid is accommodation in the posterior chamber to increase the pressure. Who can affected by glaucoma? What is the risk factor of glaucoma? Mainly, this risk factor, if anyone had any of this risk factor, he should go to a eye care and make examination for its eye. Firstly, if we having high internal eye pressure, intraocular pressure, as we said, more than greater than 21 millimeter mercury, being over age 60, having a family history of this condition, having certain medication, as we mentioned, have certain medical conditions, sorry, as diabetes, heart disease, high blood pressure, or sickle cell anemia, having certain eye condition as myopia or nearsightedness, early estrogen deficiency, in case of removal of both ovaries before age of 43. We finally taking a corticosteroid medication, as we mentioned before. Secondary type of glaucoma can caused by taking systemic or topical corticosteroid medication for long time. What are the symptoms? Mainly, we said that glaucoma is called silent thief of vision. So most people don't have any symptoms. The first sign is often loss of peripheral or side vision that can go unnoticed until late stage in disease. In patient with chronic open-angle glaucoma is present with slow, progressive, irreversible, painless peripheral vision until the disease is advanced and cause neural damage and permanent vision loss. But in acute angle closer glaucoma, we said that the angle is closed by the iris and it's caused rapid build up of the intraocular pressure. This can cause severe headache, eye pain, nausea and vomiting, blurred vision, halos around light, and eye redness. This is a eye with acute angle closer glaucoma, and this is increased convexity of the eye. Diagnosis of this of glaucoma. For diagnosis of glaucoma, tonometry can be used to we refer to eye care and the patient your doctor will relieve your medical history and make eye examination. It can use tonometry to checking or measuring the intraocular pressure, also through used as well as looking for optic nerve damage, either through imaging or by direct observation, as it has characteristic shape, making cup shape, and this is called cupping. And we can diagnose the ankle-closer glaucoma by genioscopy for inspecting the drainage angle. So, treatment of glaucoma. First medication we use as eye drops have two mechanisms to decrease the intraocular pressure, either by reduce the formation of the aqueous fluid or increase its outflow. For example of the medication used in treatment of the glaucoma, prostaglandin analogs. Prostaglandin analog, it is important or first choice, and it is increased outflow of aqueous humor by a 25 to 33%, but it has other increased the eyelash lens, conjunctival injection, darkening iris. Another treatment we can use beta-adrenergic antagonist. Beta-adrenergic blocks, it can reduce the production of the aqueous humor and decrease the intraocular pressure by a 20%. but it has also side effect as heart failure, bronchospasm, bradycardia. Here is sympathomimetics agonist. It can increase outflow and reduce production. Other medication, carbonic anhydrase inhibitors, which reduce the production, and finally hyperosmotics, which increase the blood osmolarity. Those this medication can use in treatment of the glaucoma, but in advanced condition we make surgical treatment. In this surgical treatment, laser treatment available as trabeculoplasty, where laser used to open the trabecular network in trabecular meshwork and open angle glaucoma. And there is also iridology, which use a laser to make a tiny hole or a microscopic hole in the iris, which help in treatment of the closed angle glaucoma. And there is also other laser treatment be used to create a new chemical a new channel through which the aqueous humor can be drained out. And finally, there are implants that shunt fluid out of the anterior chamber by bypassing trabecular work and collecting system. It is called synthetic tube shunt. Here back to this picture, it is trabeculoplasty surgery for intraocular pressure. And here this is tube shunt inserted to divert aqueous humor from the extraocular reservoir, implants into the subconjunctival space. For future therapy of glaucoma, there is a several method. For example, in medical treatment, new intraocular lowering topical agent will be in phases of clinical trials. In diagnosis, we make earlier detection in higher risk population through telemedicine and as imaging device, improve quality and sensitivity. Finally, in surgical, we developed a variety of techniques and devices that can enable to treatment of. This is my reference, and thank you. I hope this is be useful for everyone, and see you later.